Despite progress on several health issues, rising rates of drug deaths, obesity, diabetes, and children in poverty among Americans. They are really threatening quality of life for people. It's according to new health rankings just released today by the United Health Foundation. We have Dr. Reed Tuckson joining us live this morning from Washington, D.C. Good morning. And where does Florida stand in these new rankings?
Well, Florida stands at 33, which is not so good, and it's even worse when we think that you were 32nd last year, so you've dropped a space. So there's work to be done in Florida.
What were some of the major areas of concern when it came to health for Floridians?
What I'm most worried about as we at United Health Foundation look at this is you are the 32nd worst in the number of couch potatoes. There are just too many people who are getting no exercise other than getting up and going to work. Almost 24% of your population are couch potatoes, and that means that it's not surprising that you're 37th in the number of diabetics. In fact, 11.2% of the population is diabetic in Florida, and that worries us. And we also notice with some concern that you are 42nd in the number of high school students who graduate from high school. And that correlates very closely with overall health status. So we hope that you will be attentive to people who need to get up. If there are people watching your great show now who are sitting on that couch, they need to do some jumping jacks while they're watching your great show. We need people to get moving in the great state of Florida.
Yeah, it's such a good point. I mean, we hear how a sedentary lifestyle contributes to so many health concerns. Were there any other factors that maybe play into why people here in Florida are just more sedentary?
We really don't know that, and I think that you really have asked a great question. The whole point of America's health rankings is to get people to have this community conversation about health. We want you to care so much about whether you live or whether you die that you'll start to have that conversation at church and civic association, over the back fence, in the media, and start saying, why is it that we are not doing the things that we ought to do and should do if we're going to have the lives that we want to live? Everyone wants to live a healthy life. Why are we not doing the things that we need to do to have that life? Yeah, today's the day to make that choice.
I agree. It's such a mindset that just has to change, and you have to get in the habit of doing those things. The ones that scored high in the ranking, what did you see that they all had in common?
On our website, americashealthrankings.org, all one word, americashealthrankings.org, you'll be able to see that the people that are doing the best, the individuals who live in those states, have made better choices about their own health. Their communities have gotten more involved in creating an environment for health. Their public and elected officials are supporting healthful regulations and behaviors, and the medical care systems are focusing more on prevention than in other states. The key is to doing a lot of things well. Health is a comprehensive element, and we need to be doing things in each of those categories.
All right, Dr. Tuckson, thank you so much. Certainly giving us a challenge today to get up and get active. Appreciate the work that you guys do.
No more excuses.
All right, thank you.